head of biostatistics, epidemiology, and research design, Center for Clinical and Translational Science at the Rockefeller University, former senior research associate biometrician, consultant of the New York Academy of Medicine, associate HIV Center for Clinical and Behavioral Studies, guest researcher, Centers for Disease Control, DCS, Medical Biometry, University of Tübingen, and PhD Computer Science, University of Stuttgart. This guy has more letters around his name and background. That's why what he is saying really, really is so powerful. And it is aligning with, as I told you, there is no longer scientific consensus in the world. And there is certainly not mathematical consensus. And that's what I got to when I sat down and had this conversation with Knut Wittkowski. I hope you enjoy it. You better be ready to take notes. Grab your pen, grab your paper. I think you're about to get a huge dose of what sounds a lot like sense. I want to thank you for taking the time.
My pleasure.
You're kind of an immediate internet sensation right now. You wrote a paper recently discussing what you think might be a better approach to COVID-19. Currently, we are all locked down around the world, different variations of it. I think Sweden is the only nation I know of that actually, has avoided any sort of form of lockdown.
Mm-hmm.
But in your paper, you described what you thought would be the best approach. Could you go ahead and explain that to me? How do you think we should be dealing with COVID-19?
Well, we shouldn't really deal with it. We should just let nature take its course. And the only thing we should do is we should try to make sure that the elderly and the vulnerable don't get in contact with people who could be infected. So they should isolate until the whole thing is over, and that shouldn't take more than 4 weeks. There is no evidence around that doing any of these antisocial separation or prohibition or whatever you call it has any effect on the epidemic. With one exception, it flattening the curve, what people try to do, is broadening it. And that means it takes more time. And if it takes more time, in the end, you are putting more people at risk because nobody can, for extended periods of time, follow these draconic strategies or measurements.
I'm not against the quarantine if there's really, truly a deadly epidemic for some reason sweeping the planet, but we need to right that ship once we've discovered that the death rate's not what we thought it was going to be. Would you agree with that point, or do you think, was there enough of a panic up front to sort of start a lockdown?
Very early on, yes. Very early on, we didn't know anything. But now we have already seen the epidemic in the United States taking half of its course, so it has already peaked. And about 12,000 people have died. Make it another 12,000, that would be 24 or 25,000. That would still be lower than the average number of people dying during a regular flu season.
We are, going into a month now of lockdown or more. We're looking at a few more weeks to say in the end of April. How long would this entire thing have lasted had we gone with your approach and just said, hands off, let it run its course like other flu seasons? How long to reach that herd immunity point in your mind?
It would be over.
We'd already be through it.
Yep. The same way it did in China, it did in South Korea, it did in Australia, it did in Austria. We have lots of these examples. This is what the epidemics do. And there is no reason to expect it would be fundamentally different in the United States. It may take a bit more time because the United States is so big, so the virus doesn't get everywhere at the same time. There's a delay of a couple of days before it gets from one place to the other. And therefore it can take a bit more time, but that's not a major factor in the whole discussion.
We keep hearing about a second wave, that we now have to prepare for the second wave probably coming in the fall. Do you predict that that's something we should be preparing for? And how do you think we should prepare? if so?
We should prepare by stopping the prohibition as soon as possible, and then we have a good chance that there will be no second wave. If there is a second wave, it is because the shutdown was preventing herd immunity to build, and then if the summer is over and people stay more time indoors, then the virus will start spreading again. And the way to prevent that is to let the virus run its course right now and be done with it.
What would be your definition of herd immunity?
That enough people had contact with the virus to be immune. And if the majority of people is immune, then there is no risk for somebody else coming in to spread the virus. And then the epidemic is over.
At what point did you break away from believing in the imperial model? How early on did you start suspecting it was wrong?
From the very beginning, I never believed in it.
Why?
Well, because it didn't make any sense. And the problem is some people put out models that have no relation to reality, and then you can prove everything, including the opposite. We should use models that are actually grounded in reality. And if we do that, we get realistic estimates. They can be 10% too high or even 20%, but they will not be off by several orders of magnitude.
When you say proper models or using real numbers, I think around the world we assumed that's what was being used. What were these models built on?
I have no clue, because I couldn't see any information that would allow me to evaluate what type of model was used, other than it started with M and ended with Odle. No qualified or very few qualified epidemiologists were ever being consulted. It was all virologists and MDs, and they are not really trained in understanding the complex nonlinear systems that drive epidemics and that you have to incorporate in your thinking to make sense of the data.
Is there something specific about a respiratory disease that means we should lock down more than other illnesses? Are respiratory diseases more dangerous when we look back historically?
The influenza and coronavirus and other respiratory diseases, they all have very similar characteristics. There's nothing different between this coronavirus and previous coronaviruses, and the epidemic looks very much the same as the epidemic of influenza viruses. It's all the same. They come, they say for a moment, and then they drop, and that happens naturally, and it doesn't really require very much of an intervention.
Deborah Birx is now saying that they are going to put a code, the death code for coronavirus, on every single person that dies with coronavirus, despite whatever, whether they had some other comorbid issues that could have been deadly. Does that make the job harder for someone like you? Does that hurt our ability to really figure out what happened here if we're coding everything as COVID, even if there's a potential they died of a heart disease or a diabetes or something that was surely going to kill them otherwise this year?
Yes, it makes it much more difficult. It's one of the two things that make it difficult. The other thing that makes it difficult is when people are changing the strategy of collecting data in the midst of an epidemic, or changing the definition in the midst of an epidemic. Immediately following that, you see a huge spike or drop or some other change that has nothing to do with the epidemic, only with the reporting system.
So when we're looking at these graphs, we do see these dramatic spikes at times, or it goes up, or these high points. Is that naturally how viruses work? Do we see things spike and then they go down and come back for a while?
No, nature doesn't jump. Darwin said that. Nature doesn't jump. Epidemics go smoothly. They incline, they peak, and they decline, and they don't jump back and forth all the time.
Can you explain to me why we see these spikes in these graphs?
Well, if somebody finds, I said that before, a shoebox with reports that should have been reported and wasn't, and then sends the shoebox in, or scans the data or whatever, then suddenly there's a spike.
Makes sense. Or if suddenly one day you say this is the official code and everybody goes and grabs all their logs and then codes it, we could see a spike there too.
Yes. And we have seen that happen. We have seen that happening in China originally. So they had one of these enormous spikes, and everybody cuts off the graph because otherwise you can't see anything anymore. And then it turned, they changed the definition of what the case is. And actually, they changed it to the worse. And that's now being incorporated into many other strategies, including into what the CDC now advises people, that there should not be a test and an examination whether it was actually the virus that contributed to the death. As long as somebody dies and you find some virus, whether it had an effect or not, it's still being considered a coronavirus disease case, and that is ridiculous, but that's what it is. It makes, as you said, it makes our life much more difficult, but luckily epidemics end fast, so if we can stop the nonsense of the prohibition 100 years after the other prohibition, if we can stop that, then what we will have is the virus will just go within a couple of weeks and it will all be over.
When you look at everything you watch on the television right now, it's saying because of this lockdown, you know, we have been able to stave off the inevitable. Now they're talking about next fall. We're going to have to prepare again. Are you concerned that we have turned a corner into a new way to deal with these viruses that could see us in quarantine more often in the future?
Okay, the first thing is there is no evidence anywhere in the world that a lockdown had any positive effect. Actually, there's a lot of evidence that it is negative, that flattening the curve prolonged it and prevents herd immunity from building up. And if herd immunity is not building up, then whenever you stop the intervention, you see the epidemic do what it couldn't do before, and that is you see the number of infections or the number of cases rising again. Not as high as it before was, but it would rise again, and then people get scared again, and they start the same thing over again. And this is how you create these rebounds and these waves, and you can keep it going for a year or more just by reinstating doing these lockdowns.
So we could be starting a dangerous cycle in your mind?
Oh, if we hadn't done this, it would be over.
When I look at Tony Fauci and I look at Deborah Birx, when I see Bill Gates out there saying things like he wants to lock us down hard for 10 more weeks or something, or that we're going to have to keep using these measures, when you're living in this country, what is your thought about that approach? And are you shocked more scientists aren't stepping up to say we need to stop this?
I'm not shocked. Many of my colleagues are mathematicians, and they're not necessarily the people who like to talk to the media. So that's one of the problems that we have. So I shouldn't just blame other people. I think I should blame my own profession too. But other than that, politicians should listen to scientists who actually know something about the subject matter that is involved in their decision making. But what I don't understand is why politicians, starting with our president and the New York mayor, until a particular day, what they say makes perfect sense. The president said, this is a flu. The mayor of New York said, closing schools doesn't make any sense. And then it took them the next day, well, different days, but the next day after they said one thing, they made a 180-degree turn and said, okay, let's shut down the whole economy and let's shut down schools in New York. So why do politicians who have been saying the right thing for quite some time, from one day to the next, suddenly change their mind? I have no clue.
You know, I thought at the time Donald Trump was saying this looks like a flu. It looked like a flu to us also, and my team of scientists and mathematicians that I'm working with. But I have to imagine when the head of your health department, or Dr. Tony Fauci, who has been the head of NIAID for, multiple decades, says to you, Mr. President, you're wrong on this. People are going to die. When we're looking at the numbers, we're looking at the potential that millions could die. How does a politician override that type of statement? I mean, that would take, either a personal education we didn't know about or, a really strong sense of opinion, wouldn't it?
I think the only way to protect against is to listen to more than just one or two people. So listen to people who represent different fields and try to aggregate the information that you get and also to question them. It's not about, okay, this is the guy I believe and this is my guru and then I do whatever that person says. It should be about, okay, let's convene a couple of experts from different fields and have a discussion. And I'm not sure that this happened. I haven't heard about this happening.
So am I to understand your concern is that you don't think mathematicians were involved in this process?
I'm not aware of any. Everything I hear, all the people I hear talking are either virologists or MDs. Now, a virologist can tell you exactly how the surface of a virus looks like and many of the other things. I don't want to simplify what they're doing. An MD is trained in making a diagnosis for a particular patient and find the right treatment for that patient. So these are, of course, this is a very much an oversimplification, but these are the key issues that these professions handle. Well, we as epidemiologists are dealt with we learn how to do mathematical models, how to fit them against data, how to make sure that they're the appropriate models, and how to understand the complexity of the non-linear dynamics of that epidemics.
So when we look at numbers, I think that people would argue, you are arguing we should have just let this run its course. And I'll tell you that even on this show, which I know you haven't watched the episodes we've done, it does appear there is a small group of people that are having a very dramatic effect with this illness. And the concern was overrunning New York hospitals. I'm not in New York. I can't get inside the hospital. It looks like they're on the verge of capacity. Wasn't there a real risk that we could overrun that capacity had we just let it run its course, even if it was a small percentage? If that percentage was so acute as it appears to be, would that have been a really dramatic problem? And that's why we decided to lock it down. Go ahead.
It wasn't a real risk. Now, I would like to make one comment and correct something that I don't want to be misinterpreted. I don't say we shouldn't do anything. There's something that's very important to do, and that is to isolate or separate those who are vulnerable, who are old, who have comorbidities. They should stay away from people who could potentially be infected. So they should stay at home. But this is nothing new. In every flu season, we tell the elderly, don't use the subway, don't go by bus, don't stay at home and separate yourself, reduce the exposure to the virus because you are highly vulnerable. So that is something that definitely should take place, and we should do that. The government should pay for pharmacies to deliver all pharmacies. They should pay for food being delivered, for all the services that people are asking for to be able to separate themselves for a short period of time, and that is about 3 or 4 weeks from the epidemic. That makes perfect sense, and I'm fully supportive of that. However, shutting down schools and shutting down business has nothing to do with it, and it's actually increasing the load for the hospitals. Because if you tell elderly and people with comorbidities to separate, the epidemic is running among the children and the young adults, and they don't need to be hospitalized. They don't need it. They have a minor, either they don't realize anything, or it's a minor thing that happens. Okay, one day your nose is running, or you have a bit of a feeling a bit uncomfortable. But that's about it. The hospitals are overrun by the elderly people, mostly. So if you separate them, you're protecting the hospitals from becoming overloaded. On the other hand, if you prevent the virus from spreading among the youth, the virus stays there longer and is spreading among the elderly and those who have comorbidities. And in the end, you have more people who are dying than you would otherwise have. And I don't think that's a good public health policy.
We're seeing reports of people being arrested for being out on their surfboard out in the water, or people taking a stroll on a beach outside. They've closed down national parks, outdoor places. What do you think about the approach of keeping people from going outside and keeping them locked in their houses as an approach to stopping this illness?
Okay. The reason that we don't see flu epidemics during the summer is that people spend more time outdoors, or at least that's one of the very big factors. So it is not, respiratory diseases are not being spread outdoors. They're being spread indoors.
It's being reported that I think the Prime Minister of Australia is saying that they plan or intend on maintaining some form of social distancing and locking down until the vaccine is available. What do you have to say about waiting for this vaccine and staying with this approach until then?
I don't understand the whole thing. The first thing is, it's going to take about a year, maybe longer. Everything else is wishful thinking. It's going to take time. So we have to, whatever is being developed has to be tested, first for safety, then for efficacy, and then eventually it can be brought to the public, and that whole process takes time. And why you can, I don't see this, and I don't understand how people could even fathom this, that the society is being shut down for a whole year, let's say. Humans are social beings, and to have mental health, they need to interact with other people. And we have now seen that the last month, more guns were bought in the United States than ever before in any month, as long as people are counting guns. Now, just imagine, these guns are now in the hands of people who become less and less stable, more and more depressed, have less and less the possibility to align their thoughts with the thoughts of other people. All of the things that we humans do. What will happen? Eventually somebody will shoot somebody else because he's not wearing a mask. And I'm not joking. I really think that we have already had, yesterday or the day before yesterday, was somebody shot his partner and then himself because his partner was infected with coronavirus. And things like, if we push the whole society into the realm of insanity, I don't think that will be beneficial to the society.
Just because it's the big question going all over the internet, when there is a coronavirus vaccine, will you take a coronavirus vaccine, and why?
I usually take vaccine shots, and I will take that vaccine shot too if it has been tested and shown to be both safe and effective.
Do
I
you
would take
think
it like every other flu virus. So in a year or 2 years from now, if people have evidence that the coronavirus is about to spread again, then that should be incorporated into the annual flu vaccine and be used. I don't see any problem with that. I'm taking the other vaccines, I would take that as well.
in a world where most media and virtually every political leader in the world has agreed with the principle of using social distancing and locking down, we still hear around the world that that will be the approach going into the fall should this illness come back. It seems to me that someone of your stature and background is really putting your career on the line to step forward and make these statements that you're making right now. Can you tell me what has inspired you to write the paper that you're writing, to come on shows like this and try and tell people that you think this approach of locking down the healthy? Now, I think you made a really good point. Let's protect the elderly and the immune suppressed. I agree with that. But why are you taking this risk with your career?
I think we, as human beings and as members of society, we have a responsibility. We have the responsibility to do best what we are being trained to do, and that's what I'm doing.
Well, I want to thank you for doing it, Knut. It's really nice to be able to believe in scientists that follow the science, and you don't seem to have an agenda with this. At least when we looked into you, I don't know what you would have to gain. But it's refreshing to hear your perspective. And the truth is you're not alone. There are many, many scientists and mathematicians speaking out around the world on this topic. What would be, if you had, a moment to sit down with Donald Trump right now, what would you want to say to Donald Trump?
I would say we need to reopen schools immediately. That's the most important thing to do. And then we have to reopen businesses to keep the economy going. The initial assessment, this is a flu, is right, or was right. And because it was right, it still is right, and we should treat it as any other flu.